Welcome to the Energized Podcast, Dr. Tabatha, honey. How are you doing today?
I am so excited for this conversation. Thank you so much for having me.
Oh, I am so excited. And we're going to be talking about all the things related to women in midlife, talking about stress, bioidentical hormone therapy, metabolic flexibility, fasting, a lot of the tools that I think really move the needle for women, especially 40 and older, which, as you and I both know, is half of our life. And what I would love to do before we get in, because I haven't had you on the show before, is would you share kind of that defining moment for you, Dr. Tabitha? What was that moment for you where you wanted to move? I mean, were you always in kind of a functional practitioner, or was there a moment where you realized, being in practice, you were starting to see things in your patients and you realized that maybe you needed to take a different route in terms of how to take care of them?
Oh my goodness. So it was actually my own pain to purpose story. And I
Yeah.
think a lot of functional providers have that, where it's just some pivotal moment in their lives where they realize they can no longer do things the way they were doing them. So I'm a high school dropout. I should have never gone to college. My delivery at 17 years old of my daughter was very traumatic, and I was assigned a doctor who made it clear that he didn't want to take care of me. I was on Medicaid, so he would say things like, I get 20 cents on the dollar for you. And there was never any discussions, there was never any informed consent. Things were done to me, nothing was explained, and it was all very traumatic. And at the time, I just felt like this is how it is. Your doctor tells you what to do and you deal with it. But I had a long labor. I pushed for over 3 hours, and he finally came in and he did a forceps delivery on me that tore me from front to back. And I was never the same person after that. I still have complications to this day, but little did I know that he was a family practice doctor and he couldn't do a C-section. He had no other choices. And that discussion never happened. So I I came out of that not only a mother and a woman, but like a woman on a mission to figure out, how do I not let other girls go through what I just went through, especially my daughter, looking at her, she's a little baby and I'm just wanting to take care of her. So I figured it out. I got my GED. I went to a community college. I got all A's. I did all the things, right? I got into medical school. I went into residency. I was told, if you want to help women, be a gynecologist. Fast forward 20 years, I was miserable and I was failing my patients because I was cranking through 40 women a day, doing surgeries all day, delivering babies all night. On the surface, it was all well and good, but I really wasn't helping them. And it wasn't until I injured my back and required back surgery, and that failed, and I went back to the surgeon and he was like, it's no big deal, back surgery is like Lay's potato chips, you can't have just one. And it was at that
Mm.
moment that I just thought, what am I doing? Is this really how we treat people? And I did the unthinkable and I took 4 months off of work. It was very hard for me to give that up, to just say, okay, I'm going to abandon my patients, because that's what I felt like I was doing. But I was at my breaking point. And you might not remember, but that is actually during a time when I met you at Revitalize, which was a mind, body, green retreat in Arizona. And I found this whole world of health and wellness I knew nothing about. You talking about your podcasts and Jolene Brighton and JJ Virgin and all of these people. And I thought, there's a whole nother way to live and function, because as a doctor, all I see is disease and dysfunction. And it was just Band-Aid medicine. I was just trying to fix the symptom that was presented quickly as possible, but I was never asking, why is this happening? Why is the body so-called retaliating? I had this hateful relationship with my body, and why was it betraying me? And so I learned so much. And once your eyes are opened, you can't go back, right? Like, I tried to go back and do functional medicine with my patients, and I couldn't do it. Administration was yelling at me, you're not making enough money, you're taking too much time with patients, you're not doing enough surgery. and I left. And it's been like the hardest decision, but most rewarding decision of my whole life, because now I actually heal women. I used to do 4 to 6 surgeries a week, and now I do none. And that has been the game changer, because I'm actually getting to the root cause of what's driving the heavy periods and the fibroids and the endometriosis and the depression and the weight gain. And we're fixing that. It's so unbelievable how in the dark I was as a doctor. And so it came full circle. Like I had to go through all that trauma of helping women to actually help women, right?
Well, I'm so happy that you are, and I'm so happy that you kind of found that path that feels so good to you. And how does it feel, doing the work that you do now in relation to, the many years that you were, practicing, surgery and baby deliveries, and just being in the system, right? Being in the healthcare system.
I mean, as much as deliveries, they're miraculous. It's
Mhm.
an incredible moment. Like, I'm so grateful for all of those experiences. And I was actually reminded recently, I was out at some kind of event locally, and a woman came up to me and started crying and thanking me for saving her daughter. I had apparently done a stat C-section and saved the baby from an abruption. I didn't have any recollection of it because I was so sleep deprived all those years. But I was reminded that I'm glad I did the work that I did. It helped a lot of women. But when it comes to like daily gynecology, all of the appointments that women wait so long, they like wait for their annual and they stack up their questions and, oh, she's finally going to help me. And I really like, all we're doing is checking off boxes. We're like, did we do the breast exam? Did we do the pap smear? Did we order the colonoscopy and the screening tests? And we're not really getting to the root cause of any women's issues. So even though there's a place for life-saving acute care medicine, like in obstetrics and in surgeries and things, like we're failing women as a whole, just in general, regarding their day-to-day living and their overall wellness. We're not healthy as a society. And it turns out that we're just looking to the wrong person for help, because as a gynecologist, I spent 4 years in a surgical residency. I learned how to do a hysterectomy 4 different ways, do stat C-sections, colposcopies, all these procedures. I didn't study hormone imbalances and the endocrine system and how the gut affects our, GYN health and all of these things. So we're just looking to the wrong doctors for help, especially during perimenopause and menopause.
That's so crazy. It sounds like I give it when women come to me feeling really outraged and angry, which understandably so,
Right.
and they're going to their primary, or they're going to maybe sometimes even their gyno. And I say, it's like trying to buy milk at a hardware store. You're just gonna
Exactly.
find it there. You're not. But what's heartbreaking is I would think that I think I get why so many women, going to their gynecologist would think that that would be the place to ask about their hormones and ask about perimenopause and ask about menopause and a lot of the things that are happening that are coming up that we know are absolutely related to, hormone fluctuations and, declining, issues due to declining hormones. Except as you just mentioned that you're like, that's not what I was training for. That's not what
Right.
medicine, like what Dr. Pierre Tia calls medicine 2.0. Like that's treatment medicine, that's triage medicine. That's not preventative medicine or functional medicine at all. And so it is very much like trying to get milk from the hardware store when it really should be. It feels like you're walking into a grocery store where milk is sold.
Exactly. And a lot of it has to do with the bad data that has come out over the past 20 years.
Yeah.
Because I'll tell you, when I first started medical school, my first couple of years, I learned that hormone replacement was beneficial. It protected the cardiovascular system and your bones and your brain and all of these things. And then the WHI study came out, and literally millions of women were taken off of their hormone replacement overnight. And the media ran wild with the incorrect information that came out from that study, and everybody panicked, including doctors, because we don't want to be sued. It's a scary feeling to be sued, and we don't want to harm patients. We actually take an oath, first do no harm. And so it felt like the harmless thing to do was just to take them off of these hormones. But in reality, we, over
It
the
was one of the
past
most
20
harmful things
years,
they could
we've
have done.
realized it's one of the most harmful, especially so abruptly. So
Yeah.
I actually had the privilege of my first practice. I inherited from an older gentleman who was retiring at 74. So he practiced forever. He
Like
literally,
50 years, it sounds
yes,
like.
he delivered these women, took care of the daughters that he delivered, helped them through menopause. And so I inherited a practice of women in their 70s and 80s who were on hormone replacement, even after the WHI. And it was really scary at first, but I thought, okay, I can figure this out. I'll do it. And I learned so much from those patients. They told me about how hormones had saved their marriages and saved their pelvic floor and saved their mental state and their jobs. And like the way that I saw hormones was so different than all my colleagues, because I was hearing all this anecdotal evidence that it's good for you, it saves you. And they were so grateful to that doctor for not panicking and following the mass media and taking them off. And I had women threatening me, like, don't you dare take those hormones away. Dr. Robertson didn't do it. You're not doing it, or I'll fire you. And so it really gave me a different perspective on the whole thing. And so I've been trying to piecemeal all of this together ever since then. And I've come to the conclusion that we've really harmed a lot of women, and we're not giving them the truth. We're not having true informed conversations. We're asking for consent for things, but we're not telling them the whole story.
Yeah, I would love to get into that. Actually, one of the reasons I wanted to bring you on is talking about that in a book that I read, this year was Estrogen Matters, which has just been, a phenomenal book. And I believe one of those doctors had a review of the WHI study recently just came out, and just kind of just blowing it apart. And, if you could just say it nicely, in what a disservice we've done to millions upon millions of women. That's been 20 years that, I think what almost immediately 75+% of women came off of hormone replacement therapy due to kind of the media kind of upheaval around that. And now we know that, we've put more women at danger and at risk. And so I'd love to hear what have been some of your experiences, and are you excited for the resurgence of bringing women back on hormone replacement and also hormone supplementation? I was thinking, it was interesting to me, just kind of and I've shared this a little bit on the show before, but I also have Hashimoto's thyroiditis. And my labs are looked at every 90 days, give or take. And we are looking at optimal ranges, functional ranges, to keep my thyroid super healthy, because it took a hit. It took us a minute to figure out what's going on with me. And so my thyroid hasn't been fully the same. So I'm on not a big dosage, but a dosage to keep me in optimal range. And the one thing that was very true was that we were never going to wait until my numbers were zero, my thyroid labs, to get me in a range. But that's what I find that we sometimes do with women, is that we wait until the progesterone and estradiol tank, and
Right.
then we're like, then we'll replace them.
Mm-hmm.
Whereas that to me doesn't even make any sense. I would be, my thought kind of when I think about this, and even being in the lived experience of perimenopause, is that, as we start to see these numbers decline, why wouldn't we give some level of supplementation dosage to keep us at a therapeutic, functional level? Not to, again, I'm not trying to have babies in 10 years. Like I want my neurological health to be good. I want my cardiovascular health to be good. I want my bones to be strong. And I want to have metabolic resilience. And I know that these hormones play a critical role in all of that and so much more. So I'm on my thyroid hormone and I'm also on progesterone and I'm keeping an eye on estradiol. And let me tell you, the second she starts to like creep, I'm getting on an estradiol patch. And so I don't want to wait until 51
Right.
to then, once everything, when that decline had been happening for 6+ years, depending on the person. And the decline's already happening to me at 44.
Absolutely. Why should we wait until we are so miserable that we can't function to seek help? And you and I are so much alike. I developed Hashimoto's after my delivery at 17. So I've dealt with that this whole time. And I went on progesterone probably 5 or 6 years ago. So early 40s, I found that I was getting crazy heavy periods, having estrogen dominance, feeling anxious, not sleeping when I actually had a chance to sleep for a couple hours. And progesterone was a game changer for me. It literally gave me my ability to function back. And then about a year and a half, maybe 2 years ago at this point, I found myself sitting on the couch for 2 days. And at one point, my husband sat down next to me and he was like, "What is wrong with you? It's like the middle of the day. Don't you have a podcast to do or something?" And all I could think in my head was, "Oh my God, would you stop talking to me? I can't stand you. Like, get away from me." And I was a shell of myself. And it took me until the third day when I thought, "Oh my gosh, I wonder if my estrogen tanked." And lo and behold, it had. I put an estradiol patch on and it was just a baby dose because I was scared. I didn't know. I was like, why do I need this so young? I'm still in my 40s. I put this little baby dose on and I got off the couch. And then I put double dose on and I felt like myself again, like in days. And that was the biggest wake up call ever to me. Like, oh my gosh, I am letting my patients suffer unnecessarily and just be miserable and not function and be told they're depressed and get their antidepressants from their doctors. And we're not dealing with it until their periods are done, or until they have
Right.
full on
After years of suffering and
right. And
struggling.
Mariza, I couldn't function. Like, I didn't want to do my job anymore. I didn't want to be married. Like, I couldn't believe the impact it had. And that was a wake up call to me to take a stance and say, you know what? Hormones are that important. They actually make you who you are. And if we don't focus on keeping them in balance, like, your whole life could fall apart and nobody's realizing that. And so that is when I really started pushing for just educating women and helping them understand all these little things that they're feeling, the fatigue, the joint pain, the not wanting to go out with their friends anymore. They're not wanting to have sex with their partner. Like, it's probably your hormones are out of balance and we need to evaluate that. So I'm with you. I'm not waiting until I'm at zero. Like, I am now on my estrogen and progesterone and I will hurt someone if I have to go off of it.
Well, that's what I'm saying. It's just and we're, like I said, I'm looking at my estrogen levels pretty carefully because I feel like there's some signs that are showing a need for an estradiol patch. And there's a part of me is like, well, you're only 44. Like, do you really need an estradiol patch yet? But again, I'm getting perimenopausal rage. I'm just noticing some things. I get horrible migraines right before my period that can last for 3 days. And there's just a couple symptoms that, I thought, well, let me try progesterone first because that has been low for me for a very long time. And so that was kind of the first good step to start. And I'm running labs. I'm also, I have a functional doctor who just wants to kind of, cover their booty. So I'm doing another PAP. I'm going to do a mammogram. I breastfed Kingston until July. And so I was just like, I'm not doing a mammogram while I'm breastfeeding. I just refuse. And
yes,
so it's
that is not a good idea. It's going to come back dense breasts. Everything looks weird.
So I was like, I'm waiting. So I'm going to do those things. And I'd be curious. I mean, I have some friends of mine who are like, you know what, a low dose estradiol patch when you're dealing with these types of symptoms and you've got some lower than normal estradiol is fine. And then I have some friends who still are kind of in the conventional way, are like, you know what, let's just make sure you are super good to go before we put a patch on you. And I think these kind of diagnostics of looking, and preventative diagnostics are worthwhile. It's something I recommend doing anyway. And I don't necessarily, I guess it really depends on, you and your practitioner, whether these types of diagnostics are necessary before you get on an estradiol patch. But what I will say, and I agree with you, is that that when we drop that level of estradiol and we head into menopause, I mean, our propensity for cardiovascular disease or dementia just significantly increases. And I know that the risk and the danger, or the concern, this kind of the scare around bioidentical hormones, particularly an estradiol patch or Premarin or something like that, is breast cancer. And what we're looking at, I mean, if I looked at it across the board, we have an overall 8% risk factor for potentially for breast cancer, but over 50% risk for cardiovascular disease. And I believe that 8% is kind of skewed, kind of a culmination across the many decades. It's not actually true the whole time. It's like a compilation of all of the total amount of years. But cardiovascular disease is definitely the one to take us out. And so, if hormones can help mitigate that risk, or even just push those major chronic conditions away, to me, that just feels like a win-win. On top of the acute symptoms that so many of us are dealing with. We're talking about later down the road, but I still think that women are really struggling and suffering because they don't think that this is an option for them, or there's been a lot of miseducation.
Yeah, exactly. You're hitting on so many important points. Like, they say your risk of breast cancer is 1 in 8. But that is if you live to the age of 85. Your risk for most women who are, in their 40s and 50s is like 1 in 26. It's because your rate increases every decade that you continue to live. So you have a lower risk in your 30s, it bumps up in 40s, it bumps up in 50s, and every decade therefore. But you mentioned something earlier. When the WHI came out, we abruptly stopped over 70% of the women who were on it. Have we seen breast cancer decrease in the past 20 years?
No,
we have not. That is a huge, important point. We've literally just lost all of our common sense. The bigger point is, if estrogen caused cancer, the majority of cancer would be in 20 and 30-year-olds when your estrogen is the highest. And it's not, it's the lowest. It's the highest in 80-year-old women who are very far removed from any kind of hormone replacement therapy. So if we just used any kind of common sense, we would know that what is being spewed is completely false. And what's even more frustrating is, if I would have went to a gynecologist with my complaints at age 45, 46, I would have been offered a birth control pill.
Yeah.
To quote unquote regulate my periods and make myself feel better, maybe help my skin. Like, it's supposed to do all of these amazing things.
Manage,
right?
support your mood, maybe. I mean, whatever's being sold as this kind of cure-all. But
and birth control pills are 10 times the amount of hormones that hormone replacement therapy is. So it's way higher doses, and we are fine and comfortable giving these to women until they're age 50. And then we panic and say, oh my gosh, you're 50 years old. You got to get off the birth control pill now. You can't have hormones anymore. And we don't question, what did those synthetic hormones do for the past 20 or 30 years that the woman was on them? And part of the WHI study, what it showed was, it studied 2 different arms. There was 2 different groups of women who just took estrogen as Premarin because they didn't have a uterus, and that's what standard of care was. And then there was the Prempro, which was synthetic conjugated equine estrogen from horse urine, and progestin. That is the arm that showed one extra breast cancer case in the group. And
That's it. One
halted the
extra.
whole thing.
Yes.
But it wasn't the estrogen group. It was the estrogen plus progestin. And that progestin is what's in all of our birth control pills. So we are giving this synthetic progesterone that is known to be harmful to women for decades. And then we tell them they have to go off and they can't have any more hormones because estrogen is the culprit. We have it so wrong. And I just really want to encourage women to be their own advocate and read the book Estrogen Matters and listen to podcasts like this and really just use your common sense, because you don't have to have a medical degree to know that none of this made any sense for women. And it really is okay. And estrogen is protective. As soon as our estrogen goes down, our risk of heart disease goes up, like you mentioned. Our insulin resistance starts to creep up. Our weight starts to creep up, which is
fat distribution shifts and changes, and not in a good way.
Absolutely. And I just want to point out the fact that I believe God created our bodies to do amazing things. And it's not that your body's failing you. Literally, fat cells make estrogen. And so when you're deplete and no longer making estrogen from your ovaries, your body is genius and says, put on more fat cells. We'll make more estrogen in her fat cells to keep her bones safe and her cardiovascular system safe. But we don't want that. So you go on hormone replacement therapy. And I'm sorry, but that's your personal decision. You should have the right to make that decision. It shouldn't be up to the doctor whether you want to go on hormones or not. You know, we don't have that kind of stigma with thyroid hormone medication. We don't have that stigma with men and testosterone, but for women, we're treated differently.
Yeah. Yeah. It's been a little bit mind blowing about how, you know, if it is recommended even today in the conventional system, that it's like the most minimal dosage and you won't go past that. So we won't get women into a range that can be really optimal, or it can at least reduce symptoms. So that has been that's been interesting to hear from so many women, is that, you know, they kind of get maxed out on their dosage and they still don't feel well. And then the other thing about the world, you know, the WHI study, which I thought was fascinating, was that we looked at we didn't focus on younger women in their 50s. A lot of these women were in their 60s and their 70s, and we didn't focus on women who had symptoms, you know, that like things like hot flashes, or, you know, and the other thing that was really interesting to me was that a lot of these women, with them being older, had a lot of, you know, metabolic risk factors. So, you know, that was happening as well. There's lots of insulin resistance, lots of cardiovascular markers that were off, and lots of kind of metabolic syndrome. So there was just so many things that went wrong with this study that really breaks my heart. And I'm just so grateful that we're moving away from it.
Oh, I think it's so important that you brought this up, because seriously, that study was not your average population of women seeking hormone therapy. The average age woman, like you mentioned, was 63. She was at least 10 years postmenopausal and been without hormones in her body for a decade.
Yeah.
The majority of women were smokers and overweight and had already developed heart disease when we gave them those hormones. And so we did learn some things from this study. We learned that if you give women hormones well after their body has been without it and they've already developed heart disease, it's harder to reverse that disease. It's harder to reverse the diabetes and the insulin resistance. And it does come with some risk, because estrogen can increase your risk of blood clot and stroke. So that seems to be from the oral form because of something called a first pass effect, where it goes through your liver and increases your clotting factors. So we know that it's safer to get estrogen transdermally through the skin with a patch or a cream or a pellet. And we know that progesterone is better than progestins. So we did learn a lot. Unfortunately, we just harmed a lot of women in the meantime, and a lot of women suffered unnecessarily, you know. And I look at women like my mom, who could have had hormones at at that point, and now she's quote unquote too old and she can't receive the benefits because she's already had bone loss and the, you know, dementia setting in and all of the things. And so all we can do is go moving forward, have that conversation with women. So if your doctor is not capable of having that conversation, you deserve to find someone who can have that conversation with you. And there are plenty of doctors out there who know the truth, who have been educated. And unfortunately, conventional OBGYNs, they still think there's no data because they are so stuck in their world of disease and dysfunction that they don't even know that the Institute for Functional Medicine and the Anti-Aging A4M Association and all of these big, huge wellness and prevention associations have been doing the studies. They're out there. They're just not talked about in the world of the conventional space. And so I say, don't even get mad at your doctor. They just don't know. They're ignorant to the whole situation.
I think you're absolutely right. You know, the most important thing we can do is be proactive for ourselves, be the CEO of our care, to take an active role in our care. We know this has been shared so often on the show, more often than probably anything else, but that, you know, if we want to have a beautiful, healthy, well life, especially, you know, in our 50s, 60s and beyond, we really need to be a part of that active conversation, a part of the team that helps to support our health span and well-being. And that means we've got to be proactive in finding the right doctors for ourselves. If we're not hearing the answer that we want, if our symptoms are not being managed appropriately, if we know that information is out there and it's not aligning with the type of care that you know that you deserve or that you know is available, like you said, there are a lot of doctors out there that are doing it, and the information is out there like never before. There are books on all of this, you know, and thank goodness, you know, a lot of the functional doctors are writing books. There is content out there. There are books like Estrogen Matters. There are books on perimenopause and menopause that really take a functional viewpoint on how we can take care of ourselves and how we can navigate. You know, I always tell my ladies, my community is, you know, go to your primary to get your labs done. Get your lab, you know, and demand all the labs, you know, come with your list of labs. I've shared them so many times here on the show. I've got printouts of them. I've got guides on them. I'm like, take this and get as many will get covered. And then
Yes.
if you're not, whatever you're not able to get covered there, then, you know, you're probably gonna have to go out of pocket, and you can get those there as well. You know, you can get them somewhere else. And so that's what I always tell people, like, get what you can get from your primary. I mean, we spend an exorbitant amount of money on insurance. You know, I have a little, as you know, I have a 3-year-old. And so we've got family coverage that we don't use. You know, it's for emergency, except that my husband and I, we get full out as many lab panels, and we, you know, kind of looking at that kind of thing as much as possible. I'll do, you know, I'm scheduling my mammogram, I'm doing all the things. So like, you know, and, you know, I've got my own thoughts on mammograms and all that too, but it's maybe for another day. Um, but I'm going to get what I can get from what I have. And then I would say that 80% or more of our healthcare needs are out of pocket. Way more than that.
Yeah. I
Like
mean,
all of it.
I run a monthly call. I actually did it today at 12 o'clock. I'm Eastern time. You probably haven't even had 12 o'clock yet.
Not yet, almost.
But all the women who are members in my medical practice, I do a monthly call and we go over labs and we answer questions and all the stuff that they're really not getting from their regular doctors. Because you're so right that they're usually told, oh, you don't need that lab, or it's not covered by insurance. And that's almost always not true. Like, it's a flat out lie. I mean, if you have decent medical coverage, you can get a hemoglobin A1C, a fasting insulin, some basic hormone labs, your complete thyroid panel, your autoimmune markers for your Hashimoto's. Like, they will cover all of them.
All
Your
of that's covered for
doctor
me.
doesn't know how to interpret those tests, so they say they're not covered because they don't want to deal with the results. I'm just being super honest right now. Like, they're not going to order you a reverse T3 because they don't know what it means. So
It took me a minute to get my reverse T3. And luckily, obviously lucky for you and I, we know how to read these labs. And so I'm like, just run them and I'm just going to take them and I will do what I do. Like just run my labs. There's my list. I haven't been able to get my fasting insulin taken care of. I've had to run that outside of my primary, and which breaks my heart. I'm just like, can we just, if insulin resistance is like the thing that's driving so much of our metabolic issues and most of the big chronic disease issues, why can't we get a cheap, it's such an inexpensive lab, why can't we get it, and if it can foretell what's happening 10 years out. And so that's, again, get what you can get, and then go out of pocket. I mean, there's a lot of lab companies, there's a lot of, thank goodness, private companies that are doing panels that you can order, and they're not super expensive. Are there specific labs that you recommend or that you love to run on your patients that you feel, especially in
absolutely.
perimenopause and menopause?
Yeah, and it's really important for women to understand that your body is dynamic and it's always changing.
Yes.
So just because your labs, quote unquote, looked normal before or were a certain level at one point doesn't mean they're always going to be, especially when you transition through perimenopause. It's very common for women to have normal cholesterol levels, normal blood sugar, everything's kind of copacetic and just fine. And then when your hormones shift and you are no longer making estrogen and progesterone from your ovaries, those numbers change drastically. And my patients are always shocked. Oh my gosh, am I dying? Why is my cholesterol so bad? What happened to my insulin or my, average blood sugar? And it's because estrogen is protective and it keeps your body as a well-oiled machine. And when that goes away, things shift, especially cholesterol. Cholesterol is the backbone ingredient of our hormones. So we take cholesterol and we make cortisol, we make progesterone, we make estrogen, we make DHEA and testosterone. So when we stop making those hormones, our cholesterol levels go up because we're no longer using it to make hormones. And so there's this transition period of, wow, your cholesterol is really a lot higher. And it's because you just stopped making your hormones. But nobody accounts for that fact. And so we have to have these conversations. I love to see trends, it's really important to see what your levels are, but it's also important to see what they are compared to what they used to be and going forward. Because if you just say get a fasting insulin and it's 10, you're like, okay, that's not great. I want it to be 5, but maybe it was 27 and now it's 10 because you've been doing such awesome work on your diet and lifestyle. Or maybe it used to be 3 and now it's 10, and you really need to turn the boat around and go the other way. So trends are super important. I love hearing that you're getting your labs like every quarter.
I'm
That
getting my labs
the
quarterly.
difference.
Yeah,
Yes.
I ran full out labs every quarter, and there have been reasons for that. This has been I would say my health has brought me to my knees in multiple occasions this year. And so because of that, I've had to look at, I think I've ran like a full panel of everything, probably 4 or 5 times this year. So honestly, an unreasonable amount of times, really.
Well,
So,
I just want to
but
say
it's
thank you
so
so much.
important.
No, thank you for sharing like your concussion journey with all of us and just being so authentic with your health journey, because women need to know that they're not alone. This is not weird or abnormal. Like, we are all going through these difficult things, and something like a concussion, you would never think that would affect your hormones, but it absolutely does. And
Yeah,
so
it wrecked
that's
so much of
right. It's
my lab.
important
Yeah.
to look at that comprehensive situation of like, oh my gosh, that trauma affected your adrenals and your ovaries and your blood sugar. It's all connected. Literally, all of our systems are taking information from each other and shifting accordingly. It's a big cogwheel. These systems are not in silos like conventional medicine would have you believe. We go to the gastroenterologist for our diarrhea and the neurologist for the numbness in our fingers and the endocrinologist for our thyroid. Literally, it's all connected. And so the more that women can understand that piece of it, and that when one system shifts, they all shift, because your body has this innate intelligence. It's always trying to be in balance. If one thing's way off, the other thing is going to shift. And so we don't think about it that way. So I love that you bring all that to light and really help women realize that it's not just straightforward, like what's happening in your pelvis.
No. And it's so fascinating about how my concussion or my post-concussion syndrome was treated. Well, it just wasn't. Let's be honest, it wasn't treated. And so, but the unfolding of kind of that aftermath was really a fascinating journey for me. And what is a concussion on someone with Hashimoto's thyroiditis who already has, kind of a wonky immune system that I had accidentally elevated a couple months earlier, that I had kept into remission until those. And what are the odds? Like, you're right. It's all interconnected. And so the one thing I will say in terms of, running labs so many times this year is I do have so many data points to pull from. But ideally, annually is amazing. If you've got something that you need to keep and monitor, 2 to 3 times a year, depending on what it is, I think is always great. And like you said, having that timeline of looking at your labs, especially kind of, ideally, I always say women, if we could look at them in your 20s, into your 30s, into your 40s, like we could see this overall trend over time and really understand what's going on with your body, especially your metabolic health, and in the correspondence to your hormone health. And so, and if you're listening, you're like, well, I never did that, or it didn't happen for me. No worries. Like, today is always a great day to start that timeline to be looking. And so, yeah, I have all my labs are all in a spreadsheet.
Absolutely. I would say, when I first see a patient, at minimum, I do the full cholesterol panel, get all the lipids, get a fasting insulin, a hemoglobin A1C, which is your average blood sugar over the past 3 months, which can shift significantly, especially with stress and other things. And so that's why you want to get an insulin, because if your insulin is okay, that means your body's still handling this elevated blood sugar and still can manage it. If your insulin's elevated and your blood sugar is elevated, you are way closer to diabetes than someone who has a regular insulin. So it all matters. I love to look at hormones and a complete thyroid panel. So that is not just the TSH and free T4. That is a total and free T4, a total and free T3, a reverse T3, thyroglobulin antibodies, thyroid peroxidase antibodies. And if there's other symptoms, I might do more autoimmune stuff, like an ANA or something like that. I also do vitamin levels. I want to see your vitamin A, your vitamin D, your B12, or methylmalonic acid, one of those markers. CRP is super, helpful. It's C-reactive protein. It tells us how much inflammation in your body. Initially, that test was just for cardiovascular disease, but what we've come to understand is the high sensitivity marker of it is really helpful just for inflammation in general. And I find that it's almost always coming from the gut. So if I see like a CRP 5, 6, 7, I'm like, oh yeah, we need to check your gut. We need to figure out what the heck's going on in your gut. As far as hormones, what the trend I see now is doctors will kind of put their toe in the water and they'll be like, okay, I'll order you an estrogen level or something. And they'll just get a couple basics. And I want to see the whole panel. I want to see your estradiol, your estrone, your progesterone, your DHEAS, your total and free testosterone, all of that. That's super helpful, because a lot of times women are struggling with low testosterone and nobody is aware, or high testosterone and nobody's aware, and DHEA and things like that. So it's like you want to get that full picture to really make a decision how to move all the pieces in the cogwheel. Because if you only work on one thing, the other pieces will shift. So I see this a lot. People will get on hormone replacement therapy, but they'll have had a thyroid issue that wasn't really addressed or dealt with. And then that gets worse, or adrenals. Like you have major adrenal dysfunction and you don't deal with it. You're trying to heal your gut or fix your thyroid. It's not going to work. You have to deal with the adrenals. And so that's where I love functional testing, because you can't really evaluate the adrenals very well in blood work. Blood is just a transport mechanism. It will tell you what's going on, like how much something was produced, but it doesn't tell you what your body's doing with those and how they're being metabolized and utilized. And when it comes to adrenals and cortisol and all of those pieces, you want to be looking at how your body's utilizing that, what your 24-hour pattern looks like. And so then we're starting to get into functional testing, but you can do so much with some basic blood tests.
I agree. And that's what I always want to emphasize. I mean, sometimes we do need to go down the rabbit hole. And I'm so grateful that you are helping women go down that rabbit hole. But I always tell women, like, I don't want you to think, because I know functional testing can get so expensive. I mean, unfortunately, it's just the way it is right now. Medicine 3.0, preventative medicine, health span medicine isn't cheap. It can get a little expensive. And I want women to know that, there are baseline labs that you can get ordered that we can start with, that you can make some major changes. But you're absolutely right. As you were listing all the things, I'm like, I was, and I'm sure so many other women are like, got it, had it, like, I'm like, oh yeah, adrenal. How do you think I got Hashimoto's in the first place? I had a massive adrenal blowout, and it wasn't a burnout, it was a blowout. Like it was, and then, and then gut issues and how that's related to, so many other things. And then, looking at how stress has a profound impact on our metabolic health, or declining hormones on our lipid panels. I mean, all of these things, it's all so interconnected. And I think kind of the big takeaways here is, get the labs done, do your annual, so that you can kind of see that timeline play out. And if your symptoms are not being managed, and as you're listening to this, or you've listened to any other podcast here or on some other shows, get a second opinion, dive deeper into what is going on, because it all is so interconnected. One of the modalities that I know that you've been educating on, outside of, treating adrenals and supporting thyroid health and obviously bioidentical hormones, but it's fasting. I know that what you're seeing a lot in your patients is what I'm seeing a lot as well, which is declining metabolic health. And, what kind of tools in our toolbox we can leverage to optimize our metabolic health. I mean, hormones being one of those beautiful tools. But talk to me about how you've seen fasting play out. Obviously, my audience is a big fan of Dr. Mindy Pell's.
Good.
And I'd be curious, do you find any difference or distinction in women who fast in perimenopause versus menopause? Do you find that hormone fluctuations, and basically it shouldn't even be called hormone fluctuations, it's just really a steady decline is what it really is. I mean, it's the fluctuating decline is really what is going on there. But does in perimenopause, are there any things that we should be or need to be mindful when it comes to fasting versus menopause, or kind of any kind of ways in which that we can optimize it in our favor?
Yeah, I think the big thing is that once you get into your 40s, you just can't eat and live the way you did in your 20s and 30s. Everything shifts. Your metabolism definitely shifts. And so you can't just like cardio your way out of that 5 pounds or go on a crash diet for 2 weeks, because your body will rebel and go, nope, we're not doing that. And you will gain the weight back. And so women get in this vicious cycle of, fad diets and different things, or trying to exercise for weight loss. And exercise is for strength and health. It's not for weight loss. Weight loss comes from eating the right foods and living the right way, honestly. And so what I found was women who started incorporating fasting, they would feel a shift in their hormones, good or bad, depending on their situation, right? And
Yeah.
so if your hormones are a hot mess and your diet is terrible, cleaning up your diet and getting control of your eating window so that you're not eating at 9, 10 o'clock at night, messing with your circadian rhythm, it's probably going to help your hormone status. But if you had a beautiful regular period every month, you were nice and fertile, you were ovulating, and then you go and you do some crazy restriction like the 1 a day food plan, it's going to affect your ovarian function and it's going to shift your period and mess it up. So I say, if you're trying to have a baby, if you're trying to be fertile and you're really in that reproductive window still, you want to do the basic healthy eating of eating in an 8 or 10 hour window. You don't want to eat 2 or 3 hours before bed. You want to focus on healthy fats and proteins and complex carbohydrates that have fiber, because fiber helps you remove your excess hormones that your body's done using. So all those basics really still come into play for reproductive women. And some people call that fasting. Like if I only eat from 8 a.m. to 6 p.m., I am fasting those other hours. So it's all semantics, really.
Right.
It's like people get into things. But I would say it's like your superpower once you're in menopause. And because your metabolism needs that extra boost. And when you don't have those hormones, you don't need as many calories. Unless you're training for a triathlon, most women in this day and age are sedentary, probably at least 6 to 8 hours of their waking day. Some of them work out half hour to an hour, but you don't need 50 or 100 grams of carbohydrates. You're just not going to burn through that sitting at your desk and doing your average day. So if you drink 2 cocktails or a pop or a glass of juice, like you're already overboard for the day. And so fasting can be a real superpower, because not only are you stopping so much calorie intake, but you're also kind of cramming it into a window of 6 to 8 hours. And most people can't consume that much in that time period.
Well, yeah, and
Right?
it's during the day. We were talking about like you're honoring that circadian rhythm. I find, and I'm sure you've worn a continuous glucose monitor, but we eat early, one for my son and also for our blood sugar. But I could eat the same meal 2 hours later, and it looked very different on my blood sugar, right? So
Absolutely.
I find that we eat often in a window, during the day where we're more thermogenically, kind of in a more thermogenic state. And then kind of in the evening time, especially a little bit after dark, when it's just going to my butt. It's really anything and everything at that point. That's when we are fasting. We're usually fasting from, like you said, 6 p.m. to 9 p.m. or 9 a.m. Sorry. And I find that my blood sugar is so much happier, and I'm not doing push-ups at night. I do a little something. We walk after dinner, but I'm not doing big things in the evening. I'm putting my son to bed. I guess I'm chasing a toddler, but a naked.
So, okay, you're doing a lot, but exactly, most of us are not expending a ton of
No.
energy. And carbohydrates, which are, they come in good forms, fruits, vegetables, things like that. But all of those empty carbohydrates like pasta, bread, rice, all the stuff, it tastes good. But if you don't burn that right away as fuel, your body has to do something with it. And the first thing it does is stores it in your liver as fat. And fatty liver is now the #1 cause of liver transplant in this country. And it's because we are eating too many carbohydrates. We're drinking too much wine. We're drinking too many cocktails, too much beer, all of these things. And so our body has to store it as fat, and it has to pump out insulin to do that job. So the more that you eat, the more insulin you have to produce, the more you have to try and regulate that blood sugar. And that's how things become dysfunctional. So we get into this state of being a sugar burner. And my 13-year-old daughter, she can handle it because she plays basketball and volleyball and rides her bike
She's
everywhere.
earning her carbs.
Right. She is burning the crap out of her carbs. Whereas I need to eat protein and fat, which is slower acting and more satiating, so that I'm not hungry again in 2 hours. I don't want to eat again. And I can utilize that so much more effectively than all those carbohydrates. And once I realized that and got off the sugar roller coaster myself, my brain started working so much better, and I didn't get hangry and I didn't get jittery and feel crazy all of the time. And so I love teaching women how to go from sugar burner to fat burner. Mindy and I used to run in the same circles. We've had all these conversations. Like, I absolutely agree with everything that she's saying as well. And what's bigger, even bigger in like my life right now, is I've taught women how to do intermittent fasting, but when you figure out why you're trying to take care of your body, why you're fasting, why you're exercising, and you find some higher purpose for it, that's the game changer. Because all of a sudden, it's not about trying to have enough willpower and overcome your cravings and all the emotional eating that we women do. It's like, oh my gosh, there's a bigger purpose for honoring my body and doing all of these things. So if you start to add in the faith piece to fasting, it can be a real game changer for women who feel like, okay, I can't get off this vicious cycle of I try it, it works for 3 months, and then I fall back into my old habits and my old ways. It's because they're trying to rely on their own limited strength as human beings, their own willpower. And you have to search outside of yourself and have a bigger reason for why you're doing this. Like, rely on your creator for your strength, rely on your faith to get you through this. And that's where I see women really have transformations and shift their life more permanently for the better. So that's my focus right now, is just teaching women how to fast their way to like a faith-filled life, of life that is more rewarding, and it's not just about weight loss.
And I know you have a book coming out. Do you want to just quickly share the book?
Yes, I'm so excited. It's called Fast to Faith. So it explains how we're all, the systems are interconnected and how everything does come back to metabolic health, like we were talking about. And it goes through 40 days of teaching you how to go from being a sugar burner to a fat burner, while using daily Bible scriptures to meditate on for your strength, to get you through this process of learning how to fast as a woman in a healthy way that is sustainable for the rest of your life.
I love it. Thank you. I'm going to have it. So this is coming out. It's
I'm
coming out around the
sending
same
it to
time. Yeah.
you.
Yeah.
Yay.
And congratulations. And I'm just thank you so
Thank
much
you.
for sharing your knowledge and sharing your journey and sharing, the kind of the reality of what women are getting when they go to their gyno, or they go to their regular doctor, and how we get to empower ourselves to find a better team, to go and seek out information that's going to really serve us. And I just love your perspective, and I just so appreciate you sharing it today.
Oh, I'm so honored to be here. And I hope that we can get somebody to just, go out and do something different and feel better. So thank you so much for all you're doing.
Thanks, honey.